Clover. I'm your host, Clover Sterling. Thanks for joining us. This segment focuses on mental health. You may not have suffered with the illness, but know someone who does. And it's time we educate ourselves, shun the stigmas, and support the ones who need us most. Here to share a personal story of the struggles and success with mental illness is Mr. Donovan McKenzie. Donovan, welcome to the show.
Thank you for having me.
Okay, so you've gone through struggles growing up with mental illness. What was it like for you?
It was like climbing a bridge. I'd be climbing the bridge and I'd fall down, but I didn't understand what was happening to me. I didn't have the knowledge. I knew something was wrong, but I didn't know exactly what it was. I mean, I was very sensitive, very angry, very down. My heart felt really broken at times as a man, but I had to keep that internalized. And for me, I always felt like I was an outsider, an outcast.
At what age you realized this was happening?
Even from a very young age. I realized this was happening from the age of, I would say, 10 years old, but I just thought, okay, something's just wrong.
And your parents didn't clue in on that something was wrong?
They did not. They did not. In my culture, I didn't feel like I was didn't feel like I was able to talk about that. I felt like I had to keep that a secret.
Do you mind sharing what it was that you struggled with?
I struggle with depression. I struggle with anxiety. After I lost my mother, I struggle with PTSD. And also, I've had many suicidal thoughts. And that's something I had to keep a secret, though, because I didn't want to be the outsider. I wanted to be like everyone else. Were
you thinking, oh, my mind is idle, maybe I need to get into some activities while I'm thinking like this?
I did. I played basketball, so basketball was a blessing for me. I played basketball, but then I started partying. That was my activity. I wanted to party, have fun, to get rid of the pain I felt inside. So that's something I had to, that was my medicine at the time, but I had to see a therapist in order to get the help I actually needed.
At what stage in life then did you actually seek medical help?
So when I was 19, I went to see a therapist and they told me I had depression. But to me, I was ashamed of that and I thought, no, I don't have depression. For me, that felt like, okay, something's wrong, but that's not me. There's no way I could be depressed. No, but when I was 25 years old, I finally accepted that. And I had to do something about it because I was broken, I was lost, I was down. I felt alone. So I had to do something about it and I had to see my therapist. I had to read books. I had to stay on my medication.
Oh, so you had to be, so when you're on medication, what is the feeling like?
Well, medication, and people need to know this, being on antidepressants, it's not gonna make you feel like, oh, you're on top of the world and you feel so happy. It's not a happy pill. It's gonna control those feelings. It suppresses the feelings, and you're gonna feel a lot more at peace.
For a number of hours?
For a number of hours,
and
even for a day.
Off.
It does wear off, but you have to continually take the medication. For myself, I would sometimes say, no, I don't need to take it.
And when you don't, what happens? It kicks in?
It kicks in. I felt broken. I felt really down. I would always feel this heavy feeling on my heart.
So why did you feel the need just to medicate yourself, even though the doctor says? That's the only way you knew, right?
That's the only way I knew. Before I knew prayer, because I came from a really spiritual family.
Interesting. Okay.
Because I would pray and say, God, help me to feel happy. But also, that's not enough. Because prayer is definitely powerful, but getting the help you need and taking that medication changed my life.
Okay, so you use wisdom with prayer.
Wisdom,
right?
prayer, and listening to my psychologist's advice.
So eventually you overcome after your prayer and using wisdom, taking your medicine.
Absolutely.
What is it like now?
I'm not gonna say I'm this completely different man that's so happy every day, because I still struggle. Sometimes I don't want to get out of bed. But I take my medication. I read books to learn more about depression, mental health. And I've become an advocate to help other men which gave me a purpose in this life. So
Okay.
now I continually learn more. I take my medication. I see my therapist, and I want to spread the message.
You know, sometimes in the winter months, because of the way the climate is, people get depressed. Is it that time of year for you, or what is it like during the summer months when the sunshine boosts your spirit?
The sunshine can boost my spirit, but it could also lower my spirit. So in the winter months, as you said, I do feel down, but sometimes I like seeing that snow. So I could feel happy one day and down the next day in the winter because it's really cold and I don't want to freeze. But in the summertime, yeah, the sun could be shining, looks so beautiful outside, and I could still feel down because that's depression. You're going to feel down. It's a chemical imbalance at times. It's things that's happening in your life you do remember that kicks in even when the sun is shining bright on you.
What do you tell men who are suffering from what you've gone through?
I would tell men mental health is health, and positive vulnerability is a sign of strength. And there's a stigma, and it doesn't mean that it's a disgrace and you can't talk about it. You have to talk about it. Open up. It shows a sign of strength.
Yeah, I think because of the stigma, some people will keep quiet, don't even seek a diagnosis, see a therapist or anything like that, and then it prolongs and then gets worse, right?
It does. If I've had a friend, well, he's an acquaintance of mine that I knew when I was a kid. He took his life. He had 3 kids because he didn't get the help he needed. Those around him did not help him. They didn't talk about it because in my community, it's not talked about very often. It's looked down upon. So you have to get the help and you have to get the support you need because suicide is growing. Like I could tell you right now, every 40 seconds, one person commits suicide.
Statistics say.
Okay? 1 million per year. Men are 3 times more likely to commit suicide in their life.
So let me ask you, okay, so no one knew what he was going through.
No, he
So
kept it a secret.
what are some of the signs someone can look at? Say I have my family, maybe someone's going through depression. What are some of the signs that I could say something's weird's going on and seek help?
The signs of that is when someone becomes very quiet and they become very isolated. They don't want to be around people anymore. They could smile in front of you, but you can tell something's going on. If they don't want to have fun, they stop working, they don't want to communicate as much. Let's say they stay in bed all day.
All day.
Okay, men, we keep it a secret, but there's signs of depression. Suppose they're drinking too much, taking drugs excessively. That's a sign.
Why, as a man, you would keep it a secret? Is it a sign of weakness? You don't want to admit to having a problem?
As a man, we're taught to man up, be strong, right? Push through. We're told to masculinity is a sign of strength. Nothing's wrong with me. That's why vulnerability, depression, talking about these things is seen as weakness, but it's not. Like for myself to be here right now, sharing my story and telling men they can share their story is a sign of strength. And men, we are now in the process of changing that.
Okay. Now that you've gone through the struggles, now you're in your success path. Are you doing forums where you tell your story and empower other men?
Yes, I have a website that's called heartofaman.com,
Okay.
where I have different stories of different men that share their stories.
Those men are willing to talk.
They're willing to talk.
Yeah, that's good. It encourages others to speak out too.
Exactly. I
Right.
do have a men's group that I have once a month. The next one's going to be June 20th.
Is it for anyone to join? Whosoever will may come? Or
It's for men to join. It's for men.
what's the?
It's for men. Age group, I would say 20 to 34.
Okay.
Uh,
Where is that information listed?
it's listed. It's going to be listed online, Eventbrite.
Okay.
So you can look at it at Eventbrite, and you can come out to the group so we can talk. It's an open discussion.
How many members are there in the group?
It depends. Sometimes it could be 10, sometimes it could be 20, sometimes it could be 5. But no matter what, I just want it to grow so men have a open space to talk.
So for every open space that they talk, what do you take away from that? You should probably log every meeting,
Yes, their
see
story.
the highs and lows. Yeah.
Absolutely, their story. It actually, I'm a very sensitive man. I cry when I hear stories at times, but it also gives me this hope, and I get hope from it. I get this sign that it's time to just talk. And we talk, and we get to connect with one another and hear each other's stories so we don't feel alone.
So in that setting, then, one gets to open up.
You get to
Be
open
more
up,
candid.
especially around other men.
Right.
We don't have to just talk about basketball
No.
and fighting and UFC fights. We could talk about
Okay.
what we go through.
Okay. So do you see a doctor more often or less?
I see my doctor often at times, depending on how I'm feeling. And sometimes I don't need to see my doctor, but I still will keep that knowledge because knowledge is very powerful. If I need to go on YouTube and look at, okay, how to feel better, how to meditate, I will do that. But if I need to see my doctor, I'm going to see my doctor weekly, daily, or even monthly. But seeing a doctor has helped me change my life.
Okay, what can you say now to other men right now who, you know, something's going on, but you just don't want to tell their family?
Okay, well, I'll say it again. Mental health is health. Positive vulnerability is a sign of strength. Tell your family, even if you're shunned, the pain that's inside you can be released if you just open up and talk about it. I've lost a lot of people in my life since I've opened up about this stuff, but I'm not gonna stop because I'm still alive.
You told the truth and they're gone.
You're told the truth, they're gonna go, because if they don't know, they don't have the wisdom, the knowledge of what mental health is and how to help, they're gonna feel like they have to run away because they don't know. And that's what I want to happen in the West Indian community, so people can know more about this.
Yeah, knowledge is power.
Knowledge is
Educating,
power,
yeah.
absolutely.
Okay, because in some cases they may think, oh, you're going through mental illness. They're thinking, oh, you're stupid. They often say people lose a screw, or you know what it means in that term. But then you probably need medical help to take you through each day.
Absolutely, and support.
Right.
I mean, if you have a friend to talk to, your mother, your father, a friend, a brother,
That help.
the power that gives you and the hope that gives you is amazing. But I mean, if you're alone, you could still see people. You could still see a therapist. You could still see a social worker.
Okay.
You can find out who else has mental health and connect with one
How is
another.
it like going to a therapist?
That's a really good question, because there's been therapists that I had to walk out on at times because I really wasn't feeling the connection. I felt like they didn't care. They were just doing their job. And then there's therapists that helped me change my life because they opened up my heart to want to be more vulnerable and share. And they gave me steps I can take to be a better man and to overcome this depression I'm facing, to deal with my moods, things like that, and also share and help others too.
Mood swings that
Yes,
you go
absolutely.
through. Right. So finding someone who will really take time out, not just to say, here's medication, just take this. You should be visiting that therapist more often.
Yes, you should. I do want to say, if you see a psychologist, a psychotherapist, it's very helpful. Not just just take your medication.
That's some valuable information. We'll take a break. More coming up. Don't go away. Welcome back. We're talking about mental illness and how it affects our communities. Joining us is psychologist Dr. Natasha Williams, who in her practice helps clients to deal with their illness. Dr. Williams, welcome.
Thank you for having me.
Okay, so before the break, I spoke with Donovan, who have gone through mental illness and how he dealt with it. What are some of the issues you have to deal with as a psychologist?
As a psychologist, we deal with several different types of issues, mental illnesses, anything from depression, anxiety, trauma, adjustment disorders. We talk about in terms of how do you adjust to different issues and things that have occurred in life, like workplace changes, trauma. So there's a lot of different things that as psychologists we see, and we aim to work through with our patients.
So for each of what you just listed,
yes,
it's dealt with differently?
Yes, a lot of times what we'll do is that we'll have different interventions for certain things. So depression, the way that you'll treat depression, there will be slightly different interventions that we would use to then treat anxiety. Or someone that has gone through some sort of trauma, or what we look at as post-traumatic stress disorder, they'll have a certain set of interventions as well that us as psychologists will use, not only to diagnose it, but to treat it as well. And no two psychologists are really different. There's so many different ways that we that we use that can be implemented for these types of
What
disorders.
are some of those ways?
So for myself, for example, I use a couple of modalities. In particular, I use what we call cognitive behavioral therapy. So basically that looks at the way that you think is the way that you feel is the way that you behave. So we look at that as a triad, and we help to understand how those things interplay and work in these certain disorders like anxiety, depression, trauma. But I also use what we call anti-oppressive psychotherapy, and some people use that, some people don't. But I think in particular with our community, we have to look at things such as how sexism, racism, classism work in our community to actually express a lot of these mental illnesses that are really running rampant in our community.
So some of what you mentioned, that's where you're at with the depression stage, because you're thinking on a different level, so it causes you to get in a different phase.
Yes.
Right.
Yes. It's.
And you've seen similar, what do you say, patients or clients?
We could say either or, patients, clients. Yeah, we say clients. Yeah, I've seen a lot of what Donovan has gone through with a lot of the clients that have come through my practice, because a lot of times depression manifests itself in similar ways. We have certain ways that we look at how to diagnose depression. We look at things such as persistent sadness more days than not, not being able to engage in your previously enjoyed activities, a sense of hopelessness, sleep issues, issues with suicidal thoughts and ideation, concentration issues. So we look at a lot of these things, and from there we would then look at what interventions would best work for that individual depending on the symptoms that they are presenting.
So as a psychologist, they open up to you freely, or you just have to dig for information?
It depends on the client. A lot of times, depending on the client, and I will say in particular within our community, there's been the stigma
like we were talking about.
Yes.
Right.
The stigma of mental illness can be so strong, it may take a bit of time for people in particular in our community to open up. But that's for various reasons. So we talk about the stigma of mental illness in our Black community to begin with, and just making it difficult to even open up to say that you have a mental illness. But then if they actually open up and actually say that they're dealing with that mental illness, when they actually try to engage the mental illness, whatever that's available, unfortunately they're being dealt with or dealing with a lot of clinicians that don't understand the cultural nuances, in particular with our community as well. So a lot of times, a lot of our community is feeling re-traumatized as a result of trying to get help. Right. So they end up coming to my clinic. Not only myself, I also pride myself in my clinic that I also have other clinicians from ethnic communities as well that are also part of the clinic.
So you make
can
referrals.
come exactly,
right.
But then also people will come to my clinic, and then there's a sense of comfort. A lot of times they'll see me and they're like, okay, this is another, woman from an ethnic community. I see a Black woman here. My hope is that I'll be able to feel comfortable here. So I've created and curated a safe space in my clinic so that people can feel comfortable. So it may take a little time, but once they understand that this is a judgment-free zone, I'm not here to judge you. I'm actually here to actually help you and hopefully curate that journey for you. Then from there, you'll notice that people will open up.
Yep.
So some take some time.
They see the difference when they open up. How did
Right.
you deal with it when the stigma was going on with you?
How did I deal with it?
What was it like for the stigmas surrounding mental health?
Well, I kept it a secret, but I had to get, like she said, I needed a safe space. And with me, if there was a stigma, I kept it quiet when I would see a therapist, very quiet, but I was still getting the help I needed because there was so much stigma attached to that.
What would people say? What are some of the things they would say?
There's some things that a lot of people sometimes will keep it a secret, but they'll be talking about me and saying things like, he's a crazy man, he's weird. I don't know what's wrong with that guy.
That happens even today. People would say that.
Absolutely.
Yeah, they're foolish, not knowing it's a medical issue, right?
That's it. And the thing is, with that stigma, it almost pushes that person into silence. Because if I'm ostracized, there's also a chance that my family is going to be ostracized as well. So I need to keep this to myself. But they'll see people, especially in our community, walking around and say, there's something wrong with that person. Don't talk to that person. But the funny thing is, or the interesting thing is that if this person had a different illness, for example, if it was, diabetes or a heart condition or whatever, that's fine. It's fine in the sense of, there's not necessarily a stigma that's attached to it.
They'll still be their friends.
Exactly. You'll still have your social networks, you'll have your supports and that type of thing. But then if I then support somebody who has a mental illness, that stigma then can possibly rub off on me as well. So I need to push that person aside so that I am not associated with that person either. So, which then creates an additional strength in that mental illness. So if I was depressed before, and then I'm noticing that people are now being pushed away from me, that deepens the depression. And a lot of times people will seclude even more because of that as well.
We'll take a quick break. When we come back, more with Dr. Williams. Welcome back. And Dr. Williams, before we got to break, you were talking about different ways in which you would deal with your clients.
Yes.
But never have you mentioned medicine, that you administer any medicine. Why?
So as a psychologist, I do not prescribe medication. A psychiatrist or a family doctor or an MD would prescribe medication.
What's the difference between a psychologist and a psychiatrist?
So a psychiatrist will go to medical school. So as with other medical doctors, and then they specialize in psychiatry or in mental health. So primarily their role is to prescribe medication. You do have some psychiatrists that will do psychotherapy, not as often, but you will have some that will actually do that. Myself or other psychologists, usually what we do is that we also have doctorates. We don't go to medical school, but we do have doctorates. And I usually tell people that we're called scientific practitioners. We try to understand the basis of behavior. So just like a psychiatrist, we diagnose, we treat, but we don't prescribe medication.
Shouldn't the medical doctor be aware of your practice, of what you do?
Yes, and a lot of times we complement each other very well. A lot of times, depending on the severity of a client or a patient's illness, what we can do is complement one another. So they'll administer the medications to allow this person to cope with their symptoms adequately, and then the person will come to myself, so then they would be able to be engaged in psychotherapy so that they will be able to understand their symptoms and provide them with the coping strategies that they would need so that they would be able to manage those symptoms going down the road. And hopefully, if we're paired accordingly, this person won't have to be on medications for the rest of their life, depending on the type of illness that they have.
So a medical doctor will medicate the patient, then
yes.
That patient comes over to you so you can get to have a conscious conversation.
Absolutely.
Is there any point where you push back and said, okay, doctor, you can stop now?
No, well, you know what, sometimes, again, if you have a really good relationship and you can see that the person is improving as a result, making progress as a result of the in tandem treatment of the medications as well as the psychotherapy, you can also look at and ask either the psychiatrist or the family doctor to say, what would it look like to start to titrate the medication? So bring down the medication just a little bit to see if they're still managing and if they're using the coping strategies or understanding what their thought process is like, which could be the catalyst for a lot of these symptoms. So when you start to work in tandem that way, it works really well. A lot of people don't want to be on medications for the rest of their life unless it's a disorder that requires it. So there are some disorders where a lot of times you are going to have to take medication for the rest of your life. And we're talking about a lot of serious illnesses such as schizophrenia, bipolar disorder. So these are disorders where the primary intervention would be medication
for
first.
The rest of your life.
There are some that are going to require medication for the rest of their life to mitigate some of the symptoms. But then what they do is that they engage in psychotherapy so that they also have the coping skills to deal with life stresses, because life is never a straight line. Life, a lot of times, there's ups and downs. So you don't want it to be that the minute that there's a down, that this person has an absolute meltdown or breakdown. How do they mitigate and understand that even in the ups and downs, they're still able to function?
Do you find patients wanting to come to you more than going to the medical doctor because there's side effects with medicine?
Yes, so that's a huge thing, particularly in our community. A lot of times there is not only just a stigma, but a lot of miseducation, unfortunately, about medication as well. So while I don't prescribe medication, and what I would do is allow my medical brothers and sisters to actually deal with the medication piece, what I would do is I would actually give a bit of psychoeducation in regards to medication. A lot of times the stigma is that I'm going to be on this medication for the rest of my life. It's going to control me. I'm going to have no control myself. And it's going to my body's going to deteriorate as a result of this medication.
That will cause them to be more depressed.
Right.
Thinking about the effects.
Exactly, because you're thinking about the side effects, which is then perpetuating the depression even further. So what happens now is that what we look at is, educating the client a bit on what antidepressants or anti-anxiety medications, what they are actually prescribed to do, how you do take them. As an example, like for example, a lot of people may think it's like an aspirin and that you take it and once the headache is gone, it's gone, where I would educate the client and say, no, this is something you would have to take on a consistent basis. It does take several weeks for it to take effect, and you have to keep on taking it for a while so that you can reap the benefits of it, but also make sure that you're connected with your family doctor or your psychiatrist in regards to side effects, because one medication may work for one person, but another medication may not work for somebody else. So please always stay connected with your family doctor or your psychiatrist in regards to your medication.
I once read in a medical article where this lady, she's suffered from something, got medication for that, causes side effects, so she got another medication to cover that.
Yes.
She wrote a letter to the doctor saying, you're giving me this, and it caused a string of things. How do you deal with a client who comes in with that?
Yeah. Usually in those cases, I also have to make sure that I'm practicing within my scope. So when a client is coming in and their issue is their medication, I empathize with them because a lot of times the symptoms in and of themselves are difficult to manage, but at the same time, I will also ask them to advocate for themselves and go back to the family doctor or go back to the psychiatrist and inform them that these are the side effects I'm feeling, I'm not feeling well. What, if anything, can I do to help manage that? So it's to open up the client, allow them to have their voice. Maybe we start talking about assertiveness training in terms of them having their voice to speak up, because they have to be in control of their health. And that's the most important. So I would advocate for that so that the client can then go back and talk to their doctor or talk to whomever it is that has been administering the medication for them, because they know their body and they should not be afraid to actually advocate for the wellness of their own body.
What are some of the success stories you've had with your clients coming? Because I'm just thinking, coming to you, wow, no medicine, they must be looking forward to that appointment.
Oh, absolutely. So I've had quite a few. I mean, I've been in the practice now for over 13 years.
Oh,
so it's been,
congratulations.
thank you. So it's been amazing to see, especially the people that are coming from our community, being able to not only be open, but coming in, I think, initially very broken, not understanding what's going on in their lives. A lot of the clients that I've seen, especially from our community, have gone through quite a bit of trauma as well. I've seen a lot of clients that unfortunately have been either raped or been in incestual relationship, not even relationships, have been victims of incest, and how that has then perpetuated in terms of the symptoms that they're presenting today. Broken relationships, broken relationship with self as well has been a huge issue. And to see people that come in initially that are broken, but then be able to have a space where they can actually address that feelings of brokenness and being able to feel safe enough to start exploring some of those things. And a lot of times where a lot of the symptoms come in is that there's anger that they hold. Anger with whomever had, perpetuated the trauma, or anger within themselves, sort of saying, why did this happen to me, and how come I'm not strong enough to deal with this? I'm a black woman or a black man. I'm supposed to be strong, and I am not strong. So they start to beat up themselves. And a lot of times that's where the anxiety or the depression comes in, because there's this punishing of self. And we're able to really work with that in our sessions and to see people people flourish, being able to own their humanness. I talk about the permission to be human, and that's meaning to say, listen, we as human beings are able to have this experience, be able to be angry, to be sad, to have these range of emotions, and that's okay. It doesn't make you weak. It actually allows you to embody your human experience. So utilizing some of the techniques that I've learned over the years to allow that open space has been a beautiful thing over the years.
Okay, I can see why your patients would love you. Okay.
Thank you.
So yeah, that's very good. We're doing so. If anyone who has someone with mental illness can just reach out to a psychiatrist. If taking medicine, they think it's too overbearing on their loved ones.
Right.
Okay. And that's it for today's show. Join us again for coffee and conversation. Thanks for watching.